Good morning. I'm Bren Cuny, Coordinator of Member Relations for the Ohio Restaurant Association. It's my pleasure to welcome you to this free restaurant education series, How Food Safety Can Protect Your Business. Before we get started, I want to review a few housekeeping items and let you know how you can participate in today's webinar. For those of you who haven't been on a webinar before, let's orient ourselves. We're looking at an example of the GoToWebinar's attendee interface. Okay, maybe you were not. Sorry about that. Okay. Now we are looking at an example of the GoToWebinar attendee interface, which is made up of two parts. The viewer window on the left, which allows you to see everything we'll share on a screen, and the control panel on the right. Within that control panel is how you can participate in today's event, so let's look at that. By clicking the orange arrow, you can open and close your control panel. From the view menu, you can also set how the control panel not to auto-hide when inactive if you prefer to keep it always open. The audio panel provides audio information. By default, you've joined the webinar via mic and speakers. Click the audio setup to select your computer speaker or headset devices, or you can join the audio via telephone by using the Use Telephone, and the dial-in information will be displayed, including an audio pin. During the end of the presentation, you'll have the ability to send questions through the questions pane. Simply type the questions and hit send. Today's speakers will be Jean Hayden from the Ohio Department of Health, Scott Nowicki, also from the Ohio Department of Health, Tony Papillo from the National Restaurant Association Solutions, and Vito Palazzolo, National Restaurant Association Solutions. We're going to start our webinar with a refresher of what is required of restaurants in Ohio. Ms. Jean Hayden is our first speaker. Jean is a sanitary and program specialist too with the Ohio Department of Health's Food Safety Program. Her main responsibilities are providing technical support to local health districts, food industry, and the general public on issues related to food safety and coordinating Ohio's certification program. Jean has 29 years of public health experience in public health, with the majority of those in her current position. Welcome, Jean.
Thank you, Brenda. This is Jean Hayden, and it's a pleasure to be here. I'd like to talk first about the certification program. In Ohio, we currently have two levels of certification. The level 1 is a mandated training for the person in charge per shift of a risk level 1, 2, 3, and 4 FSO, which is a food service operation, or retail food establishment in certain situations. Our level 1 course consists of covering the 5 basic risk factors associated with foodborne illness, and those would be covering ideas of food sources, personal hygiene and hand washing, cross-contamination, cleaning, sanitizing of equipment and utensils, proper cooking, cooling, and holding of food. The second level of certification is a voluntary training for the food manager that would meet the requirement on our Uniform Food Code for demonstration of knowledge. Of course, this is not the only way you can demonstrate knowledge. That certification requires a little more detailed training program. It'll cover the basic risk factors that we just discussed in level 1, but it'll also go into foodborne illnesses and managing food safety. Next slide. Now, the mandated course is only required in certain situations, and that would be a new food service or a new RFE that's licensed after March 1st, 2010, which is the effective date for that rule. Also, a food service or RFE that's been implicated in a foodborne disease outbreak, and in situations where the licensor, which is the local Board of Health, has documented a failure to maintain sanitary conditions, and that they can require level 1 training. In those situations, maintaining sanitary conditions would mean Sanitarian's gone in, found issues with the facility, have asked you to correct those violations. They come back and on reinspection, and you've done that, but then the next inspection, it continues, and that's when they can require level 1. Next slide, please. In regards to certification, ODH's responsibility is a little three-way. For the level 1 and level 2, it is the requirement of the director to approve the courses of study and the providers that will provide the courses, and also the instructors. For level 2, the director is required to issue an Ohio certification for anyone who has completed the level 2 training and successfully passed the exam. And when it comes to the level 2 certification for, again, the demonstration of knowledge, this is what the local health department is looking for. There are two other ways that an individual can demonstrate knowledge. One is by having no critical violations at the time of the inspection, and then the other is to be able to address the questions of the sanitarian. And the questions they ask are based on the duties that a person in charge is required to do and the knowledge that they need to know. And it is applicable to your facility, so that we would not expect a sanitarian to say to an operator in a hamburger facility, what's the cooking temperature for crabs or lobster? That's not to be expected. Next slide. Now, in regards to our certification program, the approved providers, in our level 1 certification, we have 114 locations that offer level 1, and 5 of those are actually online courses. There's been 55 course materials approved in these locations, so a lot of them use one specific course. The level 2 certification, we have 279 locations around the state that offer the program, and there are 3 online courses provided. There have, since 1973, we've approved 8 course materials for the level 2 certification, and some of those are no longer around, so there's just a few courses that are being used. And there are 4 examinations that are used with the training. For more information regarding our certification program, there is information on our website. The ODH website is www.odh.ohio.gov. And you'll want to go to our food safety page, and under Ohio certification, a list of the providers are there and their links and telephone numbers for more information. Thank you.
Okay, great. Now I'd like to pass the mic to Scott Nowicki. He's also of the Ohio Department of Health. He's going to be discussing Ohio foodborne outbreak statistics. Scott is an epidemiologist with the Ohio Department of Health, where he's worked since 1995. He is currently employed as an infectious disease epidemiologist in the Outbreak Response and Bioterrorism Investigation Team. It's a position he's held since 2000. Scott's primary focus is Shiga toxin, E. coli infections, norovirus outbreaks, and foodborne disease outbreaks. Welcome, Scott.
Thank you, Brian, and good morning, everyone. I was asked today to go over some foodborne outbreak statistics in Ohio, and I am going to give some data from 2012 and just kind of give you a general overview. And if at the end of the presentation there are specific questions about foodborne disease outbreaks, feel free to send them into the webinar, and I'll be happy to address them. In 2012, there were a total of 366 outbreaks recognized in Ohio. This affected nearly 10,000 individuals. 9,917 people were ill, and they were identified in 61 of Ohio's 88 counties. This was a large increase over the previous year when we had 256 outbreaks identified in 2011, and it was our highest year to date as far as the number of outbreaks reported. The majority of outbreaks were institutional in nature, 36%, as you can see from the dark blue on the chart here. This was followed by healthcare-associated infections, orange in the pie chart with 24%, and then foodborne with 23%. And just a little background on these settings. Institutional settings are things like child care centers, schools, usually person-to-person spread type outbreaks in these facilities. Healthcare-associated infections are things that occur in long-term care facilities and hospitals. Once again, oftentimes person-to-person spread, such as norovirus. And then foodborne outbreaks, which is what we're here to talk about today. These are foodborne outbreaks that can occur in any setting. They may be in a restaurant. They may be in a private home. They may be something, after-school program where the Parent-Teacher Association brings in food to the school. So, if a foodborne outbreak occurs in any of the settings, it's classified under a foodborne outbreak rather than institutional or healthcare associated. So we will discuss the foodborne outbreaks today. And in 2012, there were a total of 85 outbreaks affecting 1,069 people in 32 of Ohio's 88 counties. And you can see the largest number of outbreaks were reported from our metropolitan counties of Cuyahoga, Franklin, and Hamilton, where we have Cleveland, Columbus, and Cincinnati. And then, as you can see from the yellow, those are kind of the suburban locations outside of those metropolitan centers. And then the green are kind of the more semi-rural areas. And then the gray, where we have no other outbreaks reported from them, those are the rural areas. So not too surprising, the number of outbreaks are highest where the population is greatest. And then in Ohio, we also did investigate 5 multi-state outbreaks, which were coordinated by the Centers for Disease Control and Prevention. And just a breakdown of outbreaks as far as what causes these foodborne outbreaks. We can see that just slightly over half, or 51% of our foodborne outbreaks were confirmed. And the vast majority of these, 56%, were due to norovirus. So norovirus is a very big cause of our foodborne outbreaks in Ohio, and it is a large concern for restaurants, generally associated with ill food service worker coming into the restaurant and contaminating something such as a salad or sandwich that doesn't get further cooked and then can make the individuals ill. So that can be a problem. And then this was followed by a large number of Campylobacter outbreaks, and then Shiga toxin-producing E. coli outbreaks, Clostridium perfringens, some Vibrio outbreaks, Salmonella, and Listeria. And just some clarification on the difference between a confirmed and a non-confirmed outbreak. When we talk about a confirmed outbreak, this means that the pathogen was actually discovered in the food and or stool that was submitted to the Ohio Department of Health Laboratories. So whenever there's a foodborne outbreak, the local health department investigates, and if individuals have leftover food available from their restaurant meal or from a meal that was prepared at home, we ask that food to be sent into the Ohio Department of Health Lab for evaluation. And similarly, we do request them to submit a stool for evaluation as well. So if we're able to identify the suspect pathogen in either the stool or the food, we can then confirm that outbreak. Non-confirmed outbreak is an outbreak where no pathogens were found in the food or stool. So, foods or stools may have been submitted and we just were not able to identify anything in them. Or certain instances, there's no leftover food available, so we don't have any food available for testing. And sometimes people are just not willing to provide a stool specimen. So if there's no food available or people did not provide a stool specimen, those also cannot be confirmed. And just to go over a few recent outbreaks that were investigated, these were all relatively large and multi-state outbreaks that occurred. These are sugar toxin-producing E. coli outbreaks. In 2012, there was a relatively large outbreak from E. coli serotype 026, and this was related to raw clover sprouts. And if you followed this in the news at all, this was in a restaurant chain. It was Jimmy John's, and caused quite a few illnesses in a number of states, and actually resulted in a change in Jimmy John's menu. They actually do not put any raw sprouts on their sandwiches anymore. In previous years, they had had problems with alfalfa sprouts, so they switched from alfalfa sprouts to clover sprouts, and then continued to have problems with clover sprouts causing illness. So they chose to not have this risk in their restaurants anymore, and just got rid of all sprouts on sandwiches. And then in 2013, there was a relatively large E. coli outbreak of E. coli 0121, and you probably saw this covered in the news early in the year. This was from the Farm Rich frozen foods, and while this likely didn't affect restaurants, it did have quite an impact on the Farm Rich recall, and there were a number of products recalled from Farm Rich due to this particular outbreak. And then finally, more recently in 2013, there was another E. coli 026 outbreak, and this was from a fast food chain in multiple states. It was a Mexican-type fast food chain, and it was believed to be due to lettuce that was contaminated, that was being used in the restaurants. And then finally, just a little bit about a recent outbreak of Listeria that was recently investigated, and you may have seen this also. This was a cheese outbreak due to a specialty cheese that was produced in Wisconsin, and it had just a few cases, 5 cases, 1 each in Ohio, Indiana, and Illinois, and 2 in Minnesota. Listeria monocytogenes is a pretty serious illness. It can cause death and also miscarriage. If any pregnant female is infected, it can cause her to have a miscarriage. And so it is pretty serious. And this one actually was in Ohio associated with the restaurant. The one individual in Ohio did eat a lot of different cheeses, but nothing in her food history at home revealed having this recalled cheese. It was Crave Brothers Farmstead cheese, and she did not have that in her refrigerator. And when we went back and checked receipts from food items that she had purchased, she did not have this in any of her purchases. So we went back and asked her about restaurant meals, and she had eaten a meal at a restaurant where she had had a variety cheese plate, and while the menu did not specify what types of cheeses were on the cheese plate, when they went back to the restaurant inventory, they did identify that the particular restaurant did purchase this cheese, and it was possible that she had had this cheese on her cheese plate. That's all the information I have today.
Thanks, Scott. Our next panelist is Vito Palazzolo with the National Restaurant Association Solutions. Vito is the Manager of Program Compliance for the National Restaurant Association. He ensures that the ServSafe programs remain up-to-date and technically accurate. He also addresses customer queries regarding food and alcohol safety in the workplace. He is a former administrator and sanitarian both the state and local health departments level, with over 30 years of experience in the regulatory arena. Welcome, Vito.
Good morning, everybody, and thank you. What I want to do today is just kind of give some real-life experiences that I have had during the process of actually conducting inspections in the food service industry. One thing I want to make clear, I'm not here to point a finger or say these are things that the industry does wrong. I think what we're trying to do today, at least I will say for myself, is trying to give you experiences or give you some ideas of things to prevent some of the foodborne illnesses that have been talked about earlier, to also coincide with what Gene has said and also what Tony will say as far as training and what that'll do to help you prevent these issues and hopefully help you to have a more successful business when it comes to these areas. The first area that I want to talk about, because it seems like there's always an issue when it comes to storage of raw foods as well as with processed foods. And I'm mainly talking about like in your walk-in coolers and your reach-in coolers. One experience that I had, I was conducting an inspection, walked into a large walk-in cooler, and as we were going through, I noted that they had large Crayovac containers of meat stored above processed foods. And as we were looking at that, I was walking with the manager, and there was probably a 25-gallon pot of gravy underneath these Crayovac meats. And as we looked at it, I was asking the manager what was in there, and lo and behold, what had happened over the night was that there was probably about 1.5 inches of blood floating on top of the gravy because of how it was stored. So storage of raw meats, we always recommend that they go into a large, deep container to prevent any type of spill or contaminants, but also we store it on the very bottom shelf just to prevent this issue of having blood or other juices go on to cooked or processed foods, as well as also making sure that your containers are properly covered. The next example that I have was chemical storage and cook lines as well as long-term. I was conducting an inspection and watching a cook at a grill area, and above the cook line there was 2 containers of cans, spray cans. And as I was watching the cook do his process, he took one of the cans, sprayed it on the grill, and then put hamburgers on top of where he just had sprayed. And we looked at the container. When I looked at the container here, he just put oven cleaner on the grill and put the hamburgers in it, because right next to that was a container of PAM food spray. So he accidentally grabbed the oven cleaner because it had the same colors, red and a yellow base, as comparison to utilizing the PAM food spray. Also, long-term storage of chemicals in the back dry storage area. Again, they should always be stored away from foods, single-use, single-service articles, and on the bottom shelving and those type of things as far as in your long-term. And the last example that I have, and this is something that I have both experienced very positive things that the industry has done as well as some negative things, and that's sewerage backups and what do you do. I've conducted inspections and walked into a restaurant, get back into the back kitchen, and they're back to preparing food and in operation, and the cooks and the dishwashing area staff were standing in about 3 inches of water because it was backing up through the main drain, and they were still preparing food, still washing utensils, and still operating. Unfortunately, there was a lot of issues with that. Unfortunately, again, we immediately closed the facility and had them take care of that issue prior to reopening. The flip side of that is I've also went to conduct inspections, and it would state on the front door that the facility is closed, and the manager and owner of that facility closed down and took on their own initiative to take care of a sewage backup, which is something that we would hope everybody would do. Next slide, please. One thing that I want to emphasize or re-emphasize, and both Scott and Gene talked a little bit about it, mostly Scott did, the CDC, the Center of Disease Control, has put out statistics that basically there's 47.8 million foodborne illnesses throughout the year in the United States. 127,000 people are hospitalized, and of that, 3,000 are hospitalized and die. So we're talking about something here that really can not only affect the community that you live within, but also your business and your brand and you personally and business-wise. So this is something that you really need to, and I'm sure you are, to be aware of and to take a positive, proactive approach. So some of the things that I would suggest that restaurateurs do and managers do is train staff. I know that you work on a very thin line as far as profit. I know that it's tough to get staff and keep staff, and there's a cost to having them be trained and or that training process. But I think it also, what I try to emphasize and what I just mentioned with those statistics, one foodborne illness, and you may not have to worry about training staff because you may not have an establishment to have staff in. And also, you know, I don't think anybody, in fact, I know there's not anybody who would want to have a young child or somebody, the elderly, that's very affected by a foodborne illness, and where they end up in a hospital and unfortunately die from something like that. So trained staff, if it's mandatory or not mandatory, is still worth the dollars that you invest because of what it will help you do and help them do as far as being able to perform their job, and even more importantly, it allows you to hold them accountable. Observe staff. Lots of times, you know, we are busy in our day-to-day things, and you know, staff are doing their job, and you know, you as a manager or an owner or you know, walking through all different types of areas, but do you really stand there and watch what the dishwasher is doing when he's setting up the 3-compartment sink? Do you really stand there and watch how the cook is cooking a hamburger or some types of other products? And I'm not saying you have to stand there for, you know, for hours, but it is an advantage because when the health inspector comes in, that's exactly what they're going to do. They're going to stand there and they're going to watch and or they're going to ask questions of the staff. One thing that I always did myself as well as recommend to my staff when they were conducting inspections, I don't ask the manager questions because I know the manager knows. I ask the staff that are actually doing and performing the job that the station that they're at. So again, observing staff and making sure they're trained, they go hand in hand. Hand in hand. Provide positive reinforcement to staff. When you see somebody doing something right and you note that, make sure they are aware of it. Make sure that you tell them, you know, hey, great job, or, you know, this is, you know, I watched the way you properly wash the utensils, or whether you check the chemical in the 3rd-compartment sink, and reinforce that positive type action, not necessarily, you know, the inspector just got done and you didn't do this. So, you know, again, reinforce that training, reinforce positive things. Probably one of the biggest things that I rarely saw when I was in the field and or with my staff is developing a positive relationship with the regulators. I think that I can honestly say there's probably out of 100 facilities that I would inspect, maybe 2 or 3 people would say, it's good to see you, or, you know, you're more than welcome, or how are things, just a general positive relationship, not, oh my goodness, everybody running because the health inspector's here. The more that you get to have a positive relationship with the regulator, and you can ask them questions both while they're there, or if you have a question as far as after they're gone, or if you want to follow up on something, or if you have a new idea, or if you want to make sure something that you are doing or you're thinking about doing meets the codes and the requirements, that positive relationship goes a long way. And I think that, you know, when you treat somebody in a professional, positive manner, then you are also treated that way. And so I think it goes both ways. The next point that I want to make, utilize the expertise and the training abilities of regulators. Lots of times they'll put free programs on for you or free training. Or, again, if you have a question on something that you're contemplating on doing in your establishment, ask before you do it. You know, there's so many times that I walked into a facility and 6 months ago they weren't doing something, and now they're doing reduced oxygen processing, and we have to shut that down, and they don't understand why. So the more contact that you have, the more positive relationship that you can build with the regulators, the better it is, I think, for everybody. Second to last, I like to say have written policies and procedures, and lots of times people have that, but there's more dust on those than there is on the floor. So you need to make sure that you have written policies and procedures. I would recommend that, but more importantly, you need to make sure that they're updated, as well as make sure that the staff knows about them, because it doesn't do you any good to have policies and procedures and nobody's aware of what they are. And again, it will help facilitate not only for the regulator coming to show that you've taken a proactive approach to having policies and procedures in place, but also it gives you something to show your staff, as well as to evaluate your staff against, and I think that's very important. Last thing I have here is NFSM, which is the National Food Safety Month, and this website that is posted on here, what we do every year the National Restaurant Association Solutions, in conjunction with one of our other groups, puts together some type of either video or posters or some type of educational material for the industry. This year, the theme is taking action to avoid reaction. And what it is based on is food allergens. And so you can get on there and look at the videos. It starts in September every year. There's also National Food Safety Month. There's also posters on there to show different types of things that your staff can use as training, or you can use as training, or posters that you can put up on the wall, and just those types of things. So it's a really good website to go to. There's a lot of information on there, and you're more than welcome to it. With that, I'm concluded.
Thanks, Vito. I wanted to mention also that everyone that is participating on the webinar will be getting laminated posters from that website, and we will be sending those out later this week. So thanks for mentioning that, and definitely go to that website. It has some really great training tools, and it's a good opportunity for you to train your staff, and it's easy. Our last speaker is Tony Papillo. Tony has been with the National Restaurant Association for 7 years. He has an MBA in Business Administration from the Roosevelt University in Chicago. He covers 5 states, including Ohio, Indiana, Michigan, and Illinois, in his role as Great Lakes Sales Manager. His concentrations are on ServSafe, Employee Edge, and healthcare products offered by the NRA.
Thanks, Bren, very much, and good morning. This morning I will be discussing the following products here that have been created by the National Restaurant Association to help your operation create a focus on food safety and prevention. The ServSafe Manager, Food Handler, and Allergens programs have been created exclusively for our industry by industry professionals and subject matter experts. Additionally, the Ohio Restaurant Association members receive an automatic 15% discount on all of these programs as a part of your member benefit. So a very generous offering by the Ohio Restaurant Association I wanted to make sure that everybody was aware of. The manager program is designed for leadership staff. We recommend that we'd like to have one person on duty with this full certification course. The food handler program is really for your line level employee staff. Cooking behind the line, essentially, is the focus for that program. And the allergens program, which is a new program, will be a universal course for all staff. Go ahead and click the next slide, Bren. The ServSafe Manager program is a fully accredited training and certification program approved by the Ohio Department of Health. ServSafe Manager program meets the ODH's Level 2 requirement, and for the state of Ohio, it is a program that essentially it meets the requirements for the state of Ohio for Level 2, and is the program that the industry leaders ask for by name. The classroom program is to be completed in 15 hours, and that 15 hour is a required seat time regulated and determined by the Ohio Department of Health. And the exam is a up to 2 hour exam that also is essentially the Ohio Department of Health has a 15-hour training requirement plus an additional hour for the exam. The online course can be taken on demand anywhere where you have internet access. It takes on average 8 to 10 hours essentially to complete. And meets the requirements regulated by the Ohio Department of Health. Our online course is available in English and Spanish. The exams that we have are English, Spanish, Chinese, Korean, French, Canadian, Japanese, Burmese. We also offer large print. It's a 90-question secure exam, has a 5-year certification, and as I said, it's really for the state of Ohio, it meets that Level 2 requirement. Go ahead and click the next slide. The Food Handler program is approved program for Level 1 training by the ODH. It is required in Ohio for any new establishment or an operation that has a violation, any type of violation, and it also is basically the person in charge training course, or PIC training. The ServSafe Food Handler course covers core concepts of food safety. Jean had touched on them earlier. Personal hygiene, cross-contamination, time temperature control, cleaning and sanitizing. There's also job-specific guidelines within the book itself, such as how to calibrate a thermometer. The Food Handler program is designed to be a line-level staff training program, and it is a low-cost way to get your staff, your entire staff, food safety trained. As we know that all managers can't be everywhere within the operation at all times, and at such a low cost, the book with your ORA membership is $4.20 per book, or the online course is $12. This program delivers training down to the doers of your day-to-day operation, and is a great way to enhance the food safety culture within your organization. Next slide, please. The ServSafe Allergens course is a brand new course. It's just released in July, and is a 100% online program that focuses on the importance of allergy awareness within your operation. There are 15 million Americans who are considered to have a food allergy. And when you take into account their friends and family going out to dine with, we estimate a population of 50 million people are affected by food allergies in America. To help your operation capture some of this population, the ServSafe Allergens program will teach your staff in the operation the skills for front of the house, back of the house, and gain a general understanding of food allergies. The NRA has partnered with FAIR, which is the Food Allergy Research Education Group, to deliver this material. The cost of this course is $18.70 with your ORA membership, and is a great piece to add to your food safety training program. The exam is 30 questions. There's no proctor that is required. It typically takes about 90 minutes, give or take, 10 minutes essentially to take that course. Comes with a certificate of completion. And it has been newly created. It's got a brand new look and feel for the online training component. And I encourage you to go ahead and take a look on servsafe.com for a demo of the course and to get a little bit more information. Go ahead and click the next slide, Bren. And I will leave you with this. This has been a quote that was by Jim Knight, who is a former Senior Director of Training for the School of Hard Knocks, which is the training, the program that Hard Rock International uses. And he says that you have to be as passionate about food safety as you are about food. I really like this quote because we all are in this industry, realize that every day we're concentrating on the quality of food that we put out to our customers, and a part of that, a very large part of that, is also food safety. If the quality of that food, if the quality is there but it's not in safe conditions, your reputation, brand is on the line, and it's something that's always going to be, should be in the forefront of your mind. Thank you very much.
Thank you, Tony. Now we're going to take questions from the participants. I'm going to read the ones that are already sent in, but feel free to send in more. To post a question, simply type the question in the question box, which is located at the bottom right hand of your screen, and then click send. Jean and Tony, this is a question for one or both of you. We've been told that the trend in mandating food safety training for restaurant employees is expanding in a step-by-step approach. In other words, regulators start with mandated training for managers, then for persons in charge, then for someone on the premises at all hours the restaurant is open, and eventually to include all employees who handle food. Is this your impression as well?
Well, this is Jean Hayden. In Ohio, we are looking at mandating manager certification within the next couple years. We have not looked at the requirement for a food handler card. So at this point, on Ohio level, we're not. But I'm sure Tony can address it on a national level.
Yeah, nationally, we see that essentially the awareness of food safety is only growing. It's not going away, which is a great thing. And we as an industry want to be in front of it, in front of that rather than behind it and having those legislators make the regulations for us. So we do see that there is more food handler requirements and manager requirements growing throughout the country. But as I said before, from an industry perspective, we have these training programs to really be a proactive approach to the legislation.
Great. And next question is, do you encourage developing a HACCP plan, whether it's required or not?
This is Vito. There are states, or a few states right now, that are requiring HACCP. The food code basically requires that you have HACCP training and/or a HACCP program if you're doing certain types of processes within your establishment. What I would recommend to anybody is that they would be in contact with their local health department if they want to. I talked about reduced oxygen processing. That would be something that would require a variance in a HACCP program with almost any state. I think Gene can get more specific within the state of Ohio, but HACCP, in fact, the Food and Drug Administration, FDA, is looking at, I'll say, a modified HACCP program, and they're calling it active managerial control. And I think you're going to hear and see more of that being incorporated into the food code as well as a requirement as time goes on. But right now, HACCP training is just for specific processes unless there's something different that Gene has within the state of Ohio.
No, that's what we require in Ohio, is for certain situations to require a HACCP plan. And as you're saying, the active managerial control is something we would actually want to see more of. I agree.
Great. Next question is, what was the website for the 2 levels of certification?
The website in Ohio to locate more information on the certification program is www.odh.ohio.gov. And at the home page, you will see an A to Z listing. You'll want to click on F for food safety. So then you'll select food safety. And then on the left-hand side, you will see Ohio certification. Once you click on that, then you'll be able to see information about the 2 levels of training and also the list of providers. And then applications to become a provider are there too.
And you can also go to servesafe.com, and some of that information will be on there, as well as the Ohio Restaurant website, which is ohiorestaurant.org. Next question was, how do you recommend screening employees that might not be feeling good but have shown up for work yet you don't want to call off?
Yeah, this is Scott, and we don't have any recommendations for screening employees. However, in the administrative code, there is the requirement for anyone who is, actively ill, actively having diarrhea, that they are not allowed in a sensitive occupation, which includes food handlers. So if someone, is coming to work and they're, going to the bathroom and having diarrhea or vomiting, they should be sent home. Regardless of whether they want to use time or not, or there's time to be used. It's in the administrative code, and you have that, at your disposal to stand behind and say, it's the law in Ohio. You must be sent home because you're having GI illness, whether you're vomiting or diarrhea. In some instances, when an outbreak can't be solved, and we think there may be some carrier state for the employees, like if we have an ongoing salmonella outbreak that appears to be associated with a restaurant, we may do some employee screening, but that's usually primarily to identify someone who's a carrier and not symptomatic. So like typhoid Mary type situation. So that's really when we implement any kind of screening, but we don't routinely implement any kind of screening of employees who are just coming into the workplace ill. But I mean, the bottom line is they just shouldn't be at the workplace while they're actively ill, and For things like norovirus, we recommend even being out for 24 to 48 hours after their illness has ceased, if at all possible. And another concern is, just within the community, if they're caring for ill people at home, institute a good hand washing policy, once they come in the door to make sure they're washing their hands and, not exposing people because they were taking care of some ill individuals at home. We have seen that in the past where the food service worker wasn't ill at all, but they were caring for a sick child and came into work, didn't wash their hands, and then prepared something and contaminated the food that way. And so it's not always the food service worker that's ill that's the concern. And we can't really regulate anything or prevent an outbreak just through screenings.
This is Vito. Scott makes a great point, especially at the end there. But also, you can observe and watch your employees, and that's kind of the point I was trying to make during the area that I was at. If they are frequenting the restroom, or if they're coughing, if they're sneezing, when people are ill, most of us look ill. And so if you see those things, then, that could be I'll say a flag or something to hone in on. Also, and I know the staff doesn't know this, but also in the food code, it's very explicit that it's a requirement of the staff to inform the manager when they are ill, especially with certain, even sore throat and coughing, those types of things. So the observation of staff is going to be, part of the key to, I don't want to use the word screening, but finding out if they actually are ill, and then, or maybe you need just to ask them. And I understand a lot of employees, need to work and those types of things, but those are things that you have to decide, and it's in the food code that you either restrict or exclude depending on the symptoms.
Great. Next question is about food storage in a nursing home facility. Once a product like dairy or anything homemade on site, is it appropriate to store for only 3 days?
Are you saying the homemade is prepared at the restaurant or the nursing home?
Yeah,
is that correct?
Yeah, the question, food storage. In a nursing home facility, once a product like dairy or anything that's homemade on site, is it appropriate to store for 3 days only?
The food code actually allows 7 days as long as it's maintained at 41 degrees. They have to be date marked. Now in Ohio, the nursing homes are also under the Ohio Department of Health's nursing home unit, and it may be a recommendation that they're using within that code. But in the food service, it would be allowed for 7 days.
As long as it was held at that temperature?
Correct.
Okay. Great. Next question. I am a corporate chef for a food distributor. How long will my ServSafe certification be valid? How often should you get a refresher?
Your ServSafe certification is valid for 5 years. Typically, it's the day in which you took that exam. 5 years after that is when it will expire. There is, in terms of a refresher, basically a refresher course is taking the course again. You would go through the 15-hour seat time and take the course and then pass the examination. You can always do a food handler course if you are interested in going online and just getting a little bit more information on the key concepts of food safety. But the actual certification is a 5-year certification, and it expires at that time.
In regards to the Ohio certification, we are currently permanent. So once you have the Ohio, there is no recertification. But when people call in and ask about ServSafe, we will tell them that their certificate does expire every 5 years.
And we do let people know that obviously you can take the ServSafe Manager training online, and also that if they have any questions about when their certification is over, unfortunately, unless someone at the Ohio Restaurant Association gave them their test, we don't have that information, so we do have to refer them to the National Restaurant Association, just going to servsafe.com.
Yeah, and also my contact information will be there. I'm happy to look for you if you want to shoot me your name, and we can take a look at our database and see when you took your exam and when you're expired.
Great. A couple questions that came in prior to in the session, but also if you have additional questions, please send them in. We had a question about how to keep your health inspector happy. So Jean or Vito, if you have some questions, I think you did talk a little bit about it, but if you have any additional input related to how someone could keep the health inspector happy.
Well, this is Jean. I'm sorry, Vito, do you want to go first?
No, I'll go ahead.
Okay. In regards to the Ohio Sanitarians, we at the state try to encourage them to relate that they're for education. Yes, they have enforcement authority, but the idea is to help the operator make their facility better. So the best, like Vito had said in his presentation, is try to get a good conversation between the two of you, or however managers you have, and keep that line of communication open. Always call, talk to the inspector, ask them to do training, any of that. And then there are some sanitarians that are out there that just are not reachable sometimes, and you just try to do your best to work with them. Vito, can you add anything more to that?
The only thing else that I'll add to that is when they provide you with an inspection report and they've shown you that there might be some areas that you need to improve. Right. It's very easy to, get an inspection report and you have areas that need to be taken care of, and there's nothing more, I'll speak for myself, there was nothing more frustrating for me was to go through the time to conduct an inspection, go through the process as far as educating, go through the process to document it and go over each one of the areas, and then come back 6 months later and you have the same issues. That's not helping anybody. And as Jean has mentioned earlier, that yes, they have regulatory authority, but I don't feel that is what their main function is. They want to help you and to educate you, and the number one thing, they want to protect the public. But to do that, you have to also do your part, and that is cooperate and do the best you can to address the violations or the issues that are brought to your attention. There's nothing worse than coming back and writing down the same things that were the same issues 6 months before.
Great. Next question, comment and a question. So this is for Vito, the gentleman for the National Food Safety Month. First off, amazing job. Really relayed the information in a logical and easily understood manner. It's a pretty isolated situation, but in the event of our health inspector regulators not being the most helpful individual, what would be the best way to obtain information for such an occurrence? Mainly preparing for an inspection and knowing what to inspect and how to plan appropriately for the future. And that might be something where, Vito, you may want them to call you individually, or is there something you can address right now?
Well, there's a couple things there in that question. I think that, education and information and knowledge is powerful. And one thing that the state of Ohio has done that helps that is to, and I don't want to use the word unfortunately, but I think to an extent it is that they have made something mandatory, because most people will not take that training or do that training on their own. And so, to help facilitate the knowledge base and also the cooking process and the information that they need to operate a food facility, training is the key. And so, not too many people are going to sit down and look through the food code and understand all the specifics of the food code. But it goes back to what Jean and I just talked about, but also what this whole webinar is about, that is having trained staff and understanding what you have to do to operate a food facility. You don't get a driver's license without taking a test and understanding what, a stop sign means. So that does pertain, same thing, to the food industry. You should know what cold foods need to be stored at. You should know what hot foods need to be stored at. You should know the temperatures of different products. And to do that, you need to have training. You need to have that educational background. And the more educated you are as an operator, as an owner, or even as a worker, the more efficient and effective you can be within your facility. And also, it makes it easier for you when a regulator comes in, because not only can you understand what they're talking about, but you can prevent issues of what they're going to look at if you are knowledgeable in what they are observing or not observing when they come into your facility. So I feel like sometimes I'm talking out of both sides of my mouth here, but because I work for the National Restaurant Association Solutions, but I'm here to promote training. And how you get that, either get that through your regulator or get that through a course like we have, but training and knowledge is key to your success. It's key. And that's I can't emphasize that enough.
Brenda, this is Jean.
Okay.
In regard to follow up with what Vito's saying, if an operation is having some problems with a sanitarian and not understanding what they're needing or how to address those issues, we always recommend that they work up the chain and go to the next step up, which would be in the environmental health director. The state health department, the food safety program, we can get involved and intercede if there is an issue between an operator and a health department, but we like to see it settled between them. But we do have that option to be able to intercede in situations. But again, the best thing to do is to try to open that line of communication.
Good. Next question is, would a health inspector provide his checklist, which in turn can be used as a template? Or do you have a resource for that?
In regards to using our inspection form as a checklist, back in the early 80s, I would say our inspection form was probably a good checklist, but the code, the way the inspection form is now, maybe it would not be. We don't have anything specific from our department. Some of the local health departments may have something, but I guess that's something we could look at if it was requested. I don't know if SurfSafe has something like that.
It's definitely something with this question that we could work into, working with the Ohio Department of Health and the National Restaurant Association Solutions on creating such a template for our members.
I was thinking back in the, I go back a little ways, the original SurfSafe book, the essentials, not the essentials, but the course book, used to have a checklist in it, but it was based on the 76 federal code. And so I'm talking back in the early, late 80s. So there might be something in that line that we could expand on and use. I know that would be before Tony's, but I don't know if Vito remembers that or not.
I hate to admit it, Gene, but yes, I do.
Okay. Okay. I was going to say maybe it was before your time too, but
no,
that could probably be something modified.
No, I started with the 76 food code.
Right.
Well, we'll definitely work on something for our members. Another question that came in prior to the webinar was state regulations and how to keep abreast. That's definitely something, if you have any questions about that, you could definitely call the Ohio Restaurant Association. Our Government Affairs Director, Richard Mason, is very up to date on things like that, and so if you have specific questions. He also does a e-newsletter occasionally about issues, so we can definitely make sure that it's in that, as well as in News Bites.
And as well, Brenda, Richard is on our Retail Food Safety Advisory Council, which is an advisory council that does go over the regulations before they are submitted for approval, so that he would be aware of any upcoming rule changes in regards to food safety.
Great. And then we would roll those out in our e-newsletters for sure. Okay, there doesn't seem to be any other questions. So, and if you do have any questions, you can definitely email us after, and I will get those to the presenters. I'm going to go on to some upcoming Ohio Restaurant Association Restaurant Education Series events. We have 2 food safety trainings. They're in person, and they're October 15th as well as November 4th. We're in Cincinnati, and then we're going to be in Dublin. The session on October 28th, it's Grow Revenue, Get Online, and Boost Sales. That's a marketing session. It's going to be focusing on social media. All these sessions are free. And the in-person on October 28th includes lunch. So definitely go to the Ohio Restaurant Association's website and register for those classes. We also have some upcoming ORA events related to our advocacy, some PAC events in Columbus, Cleveland, and Toledo. So definitely also register for those if you are interested. If you have any additional questions on the presentation today or directly for any of the presenters, you can definitely email them. We can get slides out to you. We will also be doing since this was recorded, this will be put up on our website, I would say within the week. And now I'd like to take the opportunity to thank our panelists, Jean, Scott, Tony, and Vito. Thank you for your time, your expertise, and your wisdom.
You're welcome.
You're welcome. Thank you for the invitation.
Thank you for all attending. Thank you for your membership. After you log off, you will receive a survey, and I would love for you to complete the survey so we can have feedback on what we should continue to offer. Thank you again for your participation. This concludes today's webinar.